Have you ever looked at an ABG report and wondered where to start? Don't worry. By the end of this video, you'll be able to interpret almost every ABG using 5 simple steps. Step 1. Internal consistency. Before interpreting anything, make sure the report is internally consistent. Use this simple formula: 24 multiplied by PaCO2 divided by bicarbonates. Now compare the calculated H+ with the patient's pH. If they match, you can trust the ABG and move to the next step. If they don't match, think about a possible laboratory error or a mixed acid-base disorder before going further. Values for each pH is given in comment section below step 2. Is it acidosis or alkalosis? Look only at the pH. If the pH is less than 7.35, it's acidosis. If the pH is greater than 7.45, it's alkalosis. If the pH is between 7.35 and 7.45, the pH is normal, but don't stop there. A compensated disorder may still be present. Step 3. Is it respiratory or metabolic? Now determine the primary disorder. Remember one simple rule. The lungs control PaCO2. The kidneys control bicarbonates. If the change in PaCO2 explains the pH, it's a respiratory disorder. If the change in bicarbonates explains the pH, it's a metabolic disorder. Then check whether the body has compensated appropriately. Step 4. Check the anion gap and delta ratio. If you have metabolic acidosis, calculate the anion gap. The formula is sodium minus chloride plus bicarbonates. A normal anion gap is about 8 to 12. If the anion gap is high, calculate the delta ratio. The delta ratio helps identify whether there is a pure high anion gap metabolic acidosis or another acid-base disorder occurring at the same time. This step is especially useful in patients with diabetic ketoacidosis, lactic acidosis, or poisoning. Step 5. Check oxygenation. Finally, assess oxygenation. Start by looking at PaO2, then check SaO2. If oxygen levels are low, calculate the AA gradient. A normal AA gradient suggests hypoventilation or high altitude. Raised AA gradient suggests a problem with oxygen transfer, such as pneumonia, pulmonary edema, pulmonary embolism, or interstitial lung disease. Once you've assessed oxygenation, your ABG interpretation is complete. Remember these 5 steps. First, internal consistency. Second, acidosis or alkalosis. Third, respiratory or metabolic. Fourth, anion gap and delta ratio. Fifth, oxygenation. Practice this approach on every ABG you see, and interpreting blood gases will soon become second nature. If you found this video helpful, follow Mastering the Lungs for more simple, exam-focused lessons